And welcome back to Life Unrehearsed. Matt Del Vecchio here. I just want to get a quick little shout out. My wife Stephanie Cadu and I are going to be doing a presentation this week about senior living and downsizing trends. Where we're going to be addressing some topics about why is downsizing becoming so popular and dealing with the downsizing and transition process, what to do to maximize the value of your home. Maybe you want to age in place, but you need to put some tools in place to age at home longer. So we're going to be addressing all of those topics. And if you're interested in attending, this is a seminar that will be given free of charge, open to the public. That's this Thursday, May 9th. And the Waldorf residence, in fact, in Côte St. Luc, is going to be hosting this event. And again, open to the public, downsizing, aging in place, senior living trends. It starts at 2 p.m. This Thursday, May 9th. It's at the Waldorf. That's at 7400 Côte St. Luc Road. And you can call them 514-369-1000. That's 514-369-1000, or just simply look up residencelewaldorf.ca and you could book a spot there. And so that's this Thursday, May 9th. Hope we see you there. All right, talk about shoutouts today. And I really have to give kudos to the city of Pierrefonds for putting on this wonderful event. Tons of exhibitors, very well attended for anything that you needed to know about regarding older adults, and they had everything from the SPVM and residences there, and the Alzheimer's Society and Nova West Island, and it just went on and on. I was there with our team from Lianas Senior Transition Support and Premier Home Care. But good on you, City of Pierrefonds. When we were talking to many of the people that were there, I always inquire, what are some of the pain points? What are some of the questions being asked? And it turns out there were a lot of questions very similar to the texts that I would get here on Life Unrehearsed. So I wanted to address some of these texts that I'm getting. And by the way, if you have any concerns or questions about the downsizing with senior living, home care, navigating the healthcare system, text me at 514-800. I'll do my best to answer these questions, 514-800. And I'm going to go back to some texts over the last couple of weeks. There is some consistency and some frustration from you, our listeners, about having to navigate our healthcare system. And we're hearing it all the time. I try to address many of the topics, from trying to get a doctor and getting support from the CLSC and what we need to do. Time and time again, navigating the healthcare system comes up. So I don't want to start. This isn't about knocking the people involved in our public healthcare system. The CLSC social workers and doctors and nurses, they really are doing their best. I see this firsthand, whether it's in hospitals or rehab centers or in homes. But we have to admit, though, our healthcare system is stressed. Resources, as our population ages, continue to be stressed, and as a result, there is a lack of resources. We just can't get as what we really need. Now, there is some help out there, but we're trying to keep up with this aging population. They're putting more money, the government is putting more money into it, but it's not enough. And as a result, families are struggling. So one of the more popular texts that I get is related to how I can get help at home. Okay, and so what I'd like to suggest to you, we do have our CLSCs. So if you want to go through our public healthcare system and you need help at home, a couple ways of doing this. If you already have some services from the CLSC, you approach your caseworker and you start from there to get an evaluation. If you don't, and you're struggling at home, it could be yourself, it could be your mom or dad, it could be your spouse, and it's just becoming too much and you do need some help at home, you need some home care, the only avenue to go in the public system is through your local CLSC, and you want to be able to ask for an evaluation. It will be easier, although not mandatory, certainly easier if you can get a doctor's referral saying that, you know what, it would be a good idea. Here's a referral to the CLSC to get some help. But it's not mandatory. I've even had some clients and some of the people we take care of just simply show up physically show up to the CLSC saying, listen, I've been calling, I need answers quicker, and they're showing up. So start with the CLSC to get an evaluation saying, I need some help. I'm drowning here. I can't do this anymore. And so eventually an evaluation will be done. It may take some time. Keep advocating. Keep fighting for it. You heard our last guest, Joanne Foriatis. Just keep advocating. And what happens then in evaluation, there's a grading, a score that will be established, and then it will be determined if you can get some help at home. And help can be as simple as medication management, for example. It could be help with weekly bathing. It could be help perhaps with daily morning dressing, getting ready for bed, and evening putting to bed, undressing, and various services in between. It's not going to be 24/7 care at home. We just don't have those resources available, but there will be some help. And they'll establish a care plan for you. Usually it's never enough hours. Try to push for more. But you will get some hours eventually if it's deemed necessary. And CLSC people will come in. There's some challenges there because especially dealing with the cognitive issues, you want consistency in caregivers through the CLSC. That's a real challenge because it's not always the same caregiver. But it is what it is with our public system. And know that I always get asked, Matt, is there any other subsidies that I can get? Now, first of all, CLSC is the route to go at the beginning because there's no charge for that. But sometimes the CLSC doesn't even have the staff or the resources to get emploi. Okay, so check, emploi, like work, check emploi, where they, being the CLSC, will allow you to hire your own caregiver, and they will fund that caregiver to the tune of $19 and change. I believe it's about $19.27. So as an example, if you get 15 hours a week, they will pay $19.27 per hour, and you get to hire your caregiver, which is crucial to have some consistency. So don't be afraid to ask about Chèque Emploi. Not easy to get, but know that that program is out there. And also know that there's a home tax credit. And sometimes people will top off with private home care, a company like ours, a Premier Home Care, where it can get expensive, but know that there's about a 38% tax credit out there from the provincial government. Okay, it's considered a home tax credit that you can ask for. It's a one-time application, and it's called Tax Credit for Home Support Services for Seniors that will pay 38% of those home care expenses. So, I've only talked about this one caregiving issue. I'm going to continue with a little bit of a series every now and then of the texts that are coming in. I get a lot of requests. I need help with Alzheimer's and supporting that. By the way, speaking of Alzheimer's, another shout out to the McGill Dementia Education Program. You have to get your hands on what's called the Dementia Your Companion Guide. Just look it up, mcgill.ca, Dementia Your Companion Guide. It's available. I think they're up to 12 languages now, and that is available free online. All right, we're already out of time. I want to thank you very much for tuning in to Life Unrehearsed. And as a reminder, for all your inquiries or assistance with life transitions, home care, and the senior living industry, be my pleasure to help. You can find out more if you look up Lianas Senior Transition Support. That's Lianas, Lianas, Senior Transition Support. Many thanks to Dimitra Kritsidimos. Happy Greek Easter to you. And I want to thank you very much for listening in. And you can listen to Life Unrehearsed here on CJD 800 every Sunday at 4 p.m.